is Men's Health Month. It is a time to remind men of the importance of regular checkups and screenings and making good lifestyle choices. I recently had the opportunity to speak with Dr. Andrew Mays, a ThedaCare urologist, about the reasons men may put off seeing the doctor and how they can adopt healthier lifestyles. Take a listen. So, Men's Health Month, it is important to highlight this because, well, you can tell us men don't go to the doctor probably as much as they should, at least some men.
It's true. When we look at data, men compared to women are less frequent in their visits to mental health professionals, medical professionals, the whole gamut. And there's a number of reasons for that we can kind of get into, but the overall reason for the month is to try and discuss some of those, identify those, and see what those barriers are, because we also know from the data that men die at least 5 years earlier than women on average. So it's important that we do dedicate time exclusively to men and their health.
Let's talk about those reasons. Why do you think that men maybe don't stay on top of their health as much, going to get their screenings, even their annual wellness checks?
So I think a lot of it is out of sight, out of mind. That's one. Guys don't want to prioritize themselves. Often we're the ones that are meant to take care of the family and kind of put ourselves second. Let's quickly talk about that. Obviously, we're better when we take care of ourselves in order to help take care of others. Mm-hmm. So that's one way to do that. And then just the other thing is we're kind of stubborn. We try and think we're tougher. We can work through it. Oh, rub a little dirt on it and everything will be better.
Right. So it is important to get in and get checked. When it comes to women and men, when you compare the two, men have a higher incidence of certain types of cancers and things like that. Can you compare the two?
Yeah. So there's a large differences between men's and women's health. Specifically, men are at greater risk for cardiovascular events, things such as heart attacks and strokes. And then, as you alluded to, certain cancers are certainly higher in men. And even when they're diagnosed and how quickly they receive treatment can disproportionately affect them at greater and more advanced levels than women.
So what do you recommend that men do? Obviously, establish that relationship with a primary care provider and get that annual wellness check.
Yeah, Stacey, I like to think about things in stories because that helps us relate things in life. So my house is below the city street. So what that means for sewage, it's an important thing, sewage, it has to go uphill. Well, I have this little collecting area for the sewage for my house and a pump that sends it uphill. If that pump fails, and it has, it ends up in my basement. Not a pretty situation. It definitely stressful times for me and the family.
I can imagine.
So what we've done is we have a couple alarms, right? If that water level in that well gets higher than it should be, something alerts us to the problem. Get this addressed or you're going to end up with sewage in your basement. So we have now several of those so that we can identify the problem before it's really urgent and we're dealing with a mess. So I make that comparison because when we talk about health concerns, if you establish that relationship with your primary care physician or their office, then they can help you identify things earlier. What are those warning signs? How can we address those? And so starting there with a annual wellness visit, most insurance companies, Medicare, they cover that. And so that's a great opportunity for you to meet with that healthcare provider, talk to them about your health history, your family history. And then, of course, they do everything else during the office visit that you expect. So that means a physical exam, talking about vaccines, screening tests, all those things that may be early warning signs that can help prevent future problems. Don't want that back up in your basement.
I like your analogy. So Men, as far as living healthier lives, what can they do? Probably eat better, get a good night's rest, and many other things.
Yeah, and this is tough because I don't want to come at a patient like I'm on a high horse, right? I'm right there with them. And we're here in Green Bay. I'll make the comparison to coaches, right? And we have professional athletes here in Green Bay that perform at the highest level and still have coaches, right? They have strength and conditioning coaches. They have their position coaches. They have their head coaches. I want men, this applies to ladies too, but specifically for men, we know that coaching role pretty well. And to get instruction on what that means. How are we with our weight? Is our weight in the range that it should be? Are we doing healthy habits such as our eating? What are we drinking? And even our exercise, right? We all know we should be doing aerobic and anaerobic, or at least I hope people know that. And that's part of us as a coaching. So we want you doing aerobic exercise, and then especially as we age, the anaerobic, or our ability to lift things, becomes increasingly important to maintain that muscle mass. So I try and look at my job as that coach who comes alongside you and is your partner in trying to drive the highest quality of life for the longest period of time.
That's great. Smoking, obviously. Cut back, don't do it.
Yeah, and that too, again, I try not to be the guy that is harping on someone. So as a urologist, I see bladder cancer, which is very commonly associated with smoking. And I mean, pick a habit that you started as a teenager and try and change or quit that. It's impossible without some degree of a plan and execution on that plan. So that's what I try and do is I approach the guy, we'll call him Fred, and I'll say, hey, Fred, I know you probably, snuck some cigarettes from your mom or dad, and you started around age, 13, 11, and then they start to engage and they'll say, yeah, I started at this age and your story's exactly right. And dad did this to me when he caught me. But so now that we know that, okay, and he identifies that I'm coming from a good place. I'm not trying to chastise them. I'm really trying to get them to see this will drive, the future outcomes. So let's develop a plan in which we can see ourselves starting that process of quitting. I can give some tools, medications, other coaching things that we can get through this, and this will be something that we will overcome together. When a man sees their primary care provider, a PSA, or prostate specific antigen, a blood test, starts somewhere, depending on the risk factors, around 50. If there are risk factors, so those include family history of prostate cancer, those who have African lineage, so what we consider Black individuals, have a higher risk. Those are outside of screening, but if you fall into the general screening from age 50, 55 to 70, we screen with the PSA, the blood test, and part of the physical exam. And so in identifying anything that would be abnormal there, then we may move forward with further diagnostic studies.
Out of curiosity, in Northeast Wisconsin, how many men do you see regularly who might have prostate cancer or prostate issues?
So prostate issues is almost 100%. I mean, if I see a guy who, God willing, is old enough, that prostate has grown. So I always describe the prostate it's kind of like a donut that sits in between the bladder and the penis, and we pee through that donut hole. As we get older, that prostate starts growing, specifically after 50, and then hits another growth rate after 70, which restricts that flow of urine out of the bladder. Now, that can be benign or non-cancerous, or that can be cancerous. So about 1 in 8 men in their lifetime get prostate cancer. But almost inevitably, it's going to start to affect their ability to empty their bladder to the degree that they're used to as a younger man. And there's ways that we can help assess and address if that's benign or non-cancerous, and certainly if there is some degree of cancer seen too.
What are some of the warning signs men should look out for?
Yeah, so the obvious warning signs would be any degree of sudden involuntary loss of urine, inability to urinate, blood in the urine. Now, those are common triggers to be seen, sometimes urgent or emergently. The trouble with prostate cancer is a lot of times we don't want to see symptoms because that may be too late. So that goes back to the early screening and having the blood drawn, understanding family history, and hopefully catching it way before it's caused any symptoms.
All right. Before we wrap up here, do you have any final thoughts that you want to share with those who are watching about anything relating to prostate health or just men's health in general?
Yeah, I'll take the men's health in general. So if I'm speaking to the other half of the audience too, ladies, loved ones in your life, try and speak to them in a way that encourages them to do what they ought to take care of themselves and reflect at how much that's going to improve the ultimate way they can take care of themselves and their family. So that's number one, is really try and come from a healthy place. Hon, I love you. Let's get this evaluated. And then number two, try and do it, gentlemen, before it's an urgent or emergent. And even if it is urgent or emergent, it's good to know what that health history was. Okay, I saw Dr. Smith 2 years ago. Here were the situation then. What's been going on recently? All of that helps. So it's great to have that background for when you need it. And I hope with proper screening, you never need it.
All right. Thank you very much, Dr. Mays, also known as Coach Mays, for stopping by Off the Desk. This is all great information for Men's Health Month. We do appreciate it.